Hello, my name is Brian Casey. I'm editor-in-chief of AntMini.com, and we're here at the 2016 edition of the RSNA meeting in Chicago. We have with us right now Dr. Emanuel Kanal of the University of Pittsburgh Medical Center. He is a world-renowned expert on MRI safety, and we're going to be talking about the issue of gadolinium retention. So, Dr. Kanal, thanks for being with us today, first of all.
It's my pleasure. Thanks for inviting me.
Yeah. So, the issue of gadolinium retention in the human brain has come up in the last couple of years, and what seems to be happening is that radiologists and other researchers are finding evidence of gadolinium in the brains of people who have received multiple MRI contrast studies, and so there haven't been, to my knowledge, any clinical issues from this, but it is something that is really of concern in the radiology community. So how concerned should patients and radiologists be about this issue?
That's an excellent question. The level of concern is really has to be tempered by recognizing the potential level of benefit from having received these contrast agents as well. The real truth is that right now we don't really know if there's anything to be concerned about. There's a theoretical possibility that having these agents, or at least part of these agents, remain in the body in some form may end up having health or safety consequences, but right now the truth is we just don't know. So what we tell our patients today is that there's a potential unknown risk, but that there's a very known and quantifiable potential benefit, and so that we have to keep both of those in mind when we're deciding whether or not to administer a gadolinium-based contrast agent to our patients today.
Now, to be clear, this is a different issue from the nephrogenic systemic fibrosis issue, which sprang up maybe 10 or 15 years ago, and that issue has been mostly eliminated, correct?
Actually, I find it fascinating that you put it that way. I can't even say with confidence that it is or isn't a different issue or the same issue. We simply know that different agents have a different propensity to be associated with the development of NSF, or nephrogenic systemic fibrosis, after receiving these agents. We also know that the agents do not seem to be the same in the frequency, if you will, with which NSF develops after their prior administration. A similar statement can be made actually about the retained or residual gadolinium. We do seem to, at this point, know that all agents have residual or retained gadolinium after their administration. There do seem to be differences, and the differences may be significant amongst different agents in quantity, but again, we still don't know if there's any significance clinically.
Now, just to reiterate, if we do have any patients watching this video, no, we really don't know that if this gadolinium retention has any impact on patient health.
That's a correct statement. We have now very few studies that have formally attempted to study whether or not there are Parkinsonian symptoms or problems associated with this, and so far we haven't found any, but admittedly it's still quite early in the investigations.
Now, are you seeing patients actually concerned about this gadolinium issue? Are people refusing to have MRI exams because they're worried about this?
We are seeing patients that are asking about whether or not they should have contrast. They've heard about recent news about patients who claim that there have been problems as a result of having contrast administered, and is this a disease or is this not a disease, and what is and isn't known. So there definitely now are some patients who have begun to ask as to whether or not they should be receiving a contrast agent, and if they do, which one and how much. It is increasing in frequency right now.
And what do you typically tell people?
We tell patients first and foremost that we have their best interest in mind, and of course we're human, and that means that we can't claim to be flawless, but based on what we know today, the potential benefits of undergoing a contrast-enhanced MR examination for a particular patient can far exceed a potential risk, especially if we do our best to choose appropriately amongst the agents and to use the lowest dose that we think is required for an efficacious diagnosis.
Now, is anything being done on a regulatory level? Has the FDA gotten involved in this, or are any of the radiology societies doing anything to address this issue?
Well, this is only opinion, of course, but in my opinion, Europe is taking an exceptionally aggressive stance, and I'm actually a tiny bit concerned about the opinions that may be officially issued very shortly from Europe, and I'm quite proud of the FDA. The FDA, for what that's worth, is taking, in my opinion, a wait-and-see attitude. It's not a disease, and so they're actually sitting back and saying, let's see where this develops and stay extremely closely on top of things. But we're not going to make any rash moves until we understand more of what it is that we're dealing with, if anything.
Okay. Now, is there anything that societies are doing to improve training in gadolinium administration?
I think at this point it's a very fair statement to say that all the major radiologic societies have identified the issue, have discussed it at their meetings repeatedly, have focused on the concept of gadolinium retention, and have emphasized what we do and don't know, and have made that an integral part of the training at each of our courses.
Okay. Is there anything else we should know about this issue?
We're looking at gadolinium in the brain, which is a little ironic considering that we do know that the concentration of gadolinium in other organs in the body, such as and especially the bone, is either higher or notably higher. We've actually known that since at least 2004, and that we've known that it differs amongst the various agents out there. And for some reason, that just didn't seem to have an emotional attachment to many people. It never became the hot topic, so to speak, that gadolinium in the brain did. But the gadolinium is actually at very, very small quantities. It's actually found in many places in the body, certainly not just the brain, but the bone and the skin and the liver, the lungs. It can be found in multiple locations in exceptionally small quantities.
Okay. Dr. Kanal, thank you for being with us today.
It's my pleasure. Thanks for inviting me once again.
Signing off for AntMini.com, my name is Brian Casey.